Esdaar was started in October 2014 as a winter resilience project, initially for 5 months, and we've now been going for a year. The scheme works because we involve everybody. It's not just a health project. We also have helpers within mental health team, social care, the voluntary sector, as well as using people like the ambulance service and our own services within Provide, such as care call, wheelchair services and equipment services. And by working together, we hope that we give patients a good quality service and that we're reliable.
The central point of access is a hub of telephonists where we receive telephone calls from clinicians and the members of the general public across the whole of Mid-Essex. Once we receive the calls, we signpost them to the most appropriate service, and we have a lot of different services that we can offer. Within the central point of access hub, we have a triage nurse available who will give us clinical advice and support for any complex situations that we come across. The service is a very busy one and getting busier. At the moment, we're processing over 250 referrals, both electronically and by right fax, and we're also taking about 200 calls each day.
As a nurse assessor, I've got a lot of community experience. I've also got experience in assessment and diagnostic skills. I see patients in their own homes to assess need for provision of other services. The triage nurse sits on the CPA. They're a clinician as well. They are able to sort through referrals that might not be directly for the rapid response nurse, but there is enough urgency within the referral to make them think that an assessment is required. The overall aim is for patients to be well supported, both medically and socially, so they can stay in their own home if that's what they wish. Work very closely with social services and with various volunteer organisations as well, so that we can put a package together that the patient is happy with to try and prevent any hospital admissions. We encourage all patients to fill in an I am form. It's a piece of paper that's patient held. It has all the details about themselves, their medication, any allergies, their wishes, and therefore they can show it to ambulance crews when they turn up at the patient's house or hospital wards when they're admitted, to try and ensure that their wishes are respected.
I've been working in A&E with part of Esdaar for a year. So my involvement that was there was to look at, were they known by the community service, by the district nurses, by social care, were they known to the community matrons and voluntary sector, how we can get them back home safely and for stop readmissions if needed. But obviously some patients needed the acute setting because they were clinically unwell, so they would go on to wards and then we would follow them up. And if needed, if they were little deconditions, they met the criteria for CAS, the community assessment, which community hospitals, we have 3 of, we'd do an assessment and they would go for some rehab.
So the early supported discharge team identifies patients on the wards and supports an early discharge process, identifying people that might be suitable to go home early and with additional support if needed, and also supporting end of life and nursing needs assessments to facilitate an early and safe discharge. Some of the success stories we have are afterwards. For instance, a community matron has just mentioned to me there was a lady that we assessed and we offered some rehabilitation in a community hospital, and she's doing so much better and she's really pleased that she had the opportunity to do that. So when we're looking at somebody, we tend to look at them holistically and say, you know, these are the choices within it, this is what we can offer you. And then we very much listen to what the patient would like and be guided by them and see if we can support them ultimately to make their discharge plan. Over the last year, we've helped over 3,000 patients within Mid-Essex, and this is with the help of social care, mental health, the ambulance service, care call and other provider services.
These patients have been helped in a holistic way, so when we go to assess the patient, we look at the whole system going on in their home. Because the staff are trained across all areas, it means that they can work across whatever system needs them most. So without Esdaar, I feel that patients would be admitted to hospital and would be in crisis at home for longer, and we can help these patients without sending them to hospital and them being in the places that they want to be.